Are you waking up with high blood sugar even though you haven't eaten all night? Let's walk through what's happening in your body, why it matters, and practical, safe steps you can try to bring that morning number down. First, a simple picture of blood sugar. When you eat starchy foods, think potatoes, rice, and bread, your body breaks those foods down into glucose. That glucose enters your bloodstream, and we often call that blood sugar. Your pancreas watches those levels. When blood sugar rises, the pancreas releases insulin, a messenger that tells your cells to open up and take glucose out of the blood so the number comes down. When everything's working, insulin knocks, your cells open the door, glucose moves into the cells, and your blood sugar settles back to normal. But over time, with aging, weight gain, and eating habits that constantly flood your body with sugar, cells can become full. Imagine trying to add more groceries to an already packed cupboard. The cupboard won't take another can. That's insulin resistance. Insulin tells cells to let glucose in, and the cells don't respond. The sugar stays in the blood. Left unchecked, that circulating sugar damages small blood vessels and tissues, your eyes, kidneys, nerves, skin, and raises your risk for infections, slow wound healing, heart problems, and more. Your pancreas may try to fix the problem by making more insulin, and for a while that helps. But eventually the pancreas can wear out and blood sugar stays high. That's how prediabetes can progress to type 2 diabetes. Now to the morning mystery, you'd expect fasting, morning blood sugar, to be the day's lowest reading. After all, you haven't eaten for hours. But many people wake up with higher readings than they had the night before. A useful rule of thumb is this. If your morning value is 20 milligrams per deciliter, about 1.1 millimoles per liter, or more higher than your evening reading, that's an unusually large rise and worth investigating. There are two main reasons morning blood sugar can be high. The dawn phenomenon. During the night, your liver releases stored sugar, glycogen, to keep you going. Early morning hormones, growth hormone, adrenaline, cortisol, tell the liver to let glucose loose so you wake up with energy. In someone with insulin resistance, the liver doesn't listen to insulin when it's told to stop, so it keeps dumping sugar into the blood. At the same time, insulin's signal to other cells is weak, so the sugar stays up. This combination produces a higher fasting reading in the morning. The rebound effect. This works the opposite way. Your blood sugar falls too low during the night, often because medicine dose or timing is off, or because you exercised a lot late in the day and your body overcompensates. In a panic to protect you from dangerously low sugar, the body floods the bloodstream with glucose, and you wake up with a very high number. People who experience this sometimes report nightmares, heavy night sweats, or morning headaches. How do you know which one you have? The best way is to check a nighttime glucose reading. If possible, test it around 3 a.m. for 3 to 4 nights in a row, or use a continuous glucose monitor if you have one. If the 3 a.m. reading is normal or high, the dawn phenomenon is most likely. If it's low, the Somogyi effect is more likely. Talk these results over with your clinician. The treatments differ. What you can do right now, practical steps. Food choices in the evening. Favor protein and vegetables for your last meal, grilled fish, chicken, or a hearty salad with lean protein. These choices keep your overnight blood sugar steadier than a meal high in bread, pasta, rice, or chips. Try to finish your last meal earlier in the evening and avoid late-night snacking. Eating late can raise overnight glucose and magnify the morning rise. A small, supervised strategy some people try is a modest bedtime snack if they tend to dip too low overnight. But only do this after discussing it with your clinician. Simple, safe additions that may help a tablespoon or 2 of vinegar with your evening meal can blunt the post-meal glucose rise for some people. Always check with your clinician before making routine changes. Gentle movement after dinner. A 20 to 30-minute walk helps your large muscles use up glucose from the meal. This is one of the easiest, most effective routines you can adopt. Medication timing and doses. If your medicines or insulin doses are too strong at night, they can cause overnight lows and a rebound high in the morning. If that's a concern, bring your 3 a.m. readings and sleep symptoms, night sweats, nightmares, morning headache, to your healthcare provider. They may adjust the dose or timing. Never change insulin or medication on your own. Sleep and stress matter. Poor sleep and chronic stress raise cortisol and other hormones that push blood sugar up. Aim for consistent sleep each night. Try to be asleep by about 11 p.m. and get 6 to 8 hours, if possible. Turn off screens before bed and create a calm bedtime routine. Good sleep helps your whole metabolism. Other important points and safety reminders. If you're on blood thinners or have other medical conditions, speak with your clinician before adding supplements or making big diet changes. Spices and home remedies can support healthy habits, but they're not a substitute for prescribed medicines or a clinician's plan. If you suspect dangerous low blood sugars at night, dizziness, confusion, fainting, or very heavy sweating, seek immediate medical advice. This is something you can manage. Small, steady changes, a protein-rich evening meal, an after-dinner walk, better sleep, and careful monitoring often make a real difference. Start by checking your readings at night for a few days, bring those numbers to your clinician, and work together on a plan that fits your life and keeps you safe. You're not alone in this. With the right steps, mornings can become easier and your numbers more stable. Also, it is important to add these 5 spices in your diet. If you're already using them, that is great. If not, I encourage you to start now. Seniors, use these 5 best spices with healthy benefits to lower your blood sugar. Another night of grilled chicken breasts is good for your diet, but it's also kind of boring. Spicing up a plain but healthy meal is good for your taste buds and your health. Reach for your spice rack and you'll not only up the flavor of your food, but you'll also get a boost of antioxidants, substances that protect cells from damage. Nutrition researchers say that there are more than 100 common spices used in cooking around the world, and some have proven to be concentrated sources of antioxidants, substances that protect your cells from damage. There's no need to go on a massive hunt for exotic ingredients. Some of the best spices can be found at your local market. One note: most studies that show benefits use supplements to control the dose of spice, or the spice's active compound, that participants consume. Often these provide bigger doses than you'd normally eat in a day. 1. Does cinnamon lower blood sugar? Studies say yes. This popular spice comes from the bark of the cinnamon tree and is used in everything from pumpkin spice lattes to Cincinnati chili. Cinnamon is especially great for people who have high blood sugar. It lends a sweet taste to food without adding sugar, and studies indicate it can lower blood sugar levels in people with type 2 diabetes. Cinnamon may also provide heart-healthy benefits, such as reducing high blood cholesterol and triglyceride levels. That's especially important for people with diabetes who are at greater risk for developing heart disease. Cinnamon is not a replacement for diabetes medication or a carbohydrate-controlled diet, but it can be a helpful addition to a healthy lifestyle. Meal tip: try sprinkling it on yogurt, fruit, or hot cereal, or use it in stews and chilies or as a meat rub. 2. Can turmeric reduce inflammation? Turmeric is best known for its use in Indian curry dishes and has become a trendy superfood for its ability to reduce inflammation, a common cause of discomfort and illness. One of the components of turmeric is a substance called curcumin. Research suggests it may reduce inflammation in the brain, which has been linked to Alzheimer's disease and depression. In a small study of adults over 50, those who consumed curcumin supplements over the course of 18 months had improvement in memory test scores. They also reported being in better spirits. Most impressive? Scans of their brain indicated significantly fewer markers associated with cognitive decline. Because of its anti-inflammatory qualities, curcumin is also effective at reducing pain and swelling in people with arthritis. And animal studies indicate that curcumin could have powerful anti-cancer properties. A Johns Hopkins study found that a combination of curcumin and a chemotherapy drug was more effective at shrinking drug-resistant tumors than using chemotherapy alone. Meal tip: want to add this powerhouse spice to your diet? Rub it on roasted vegetables and meats, sprinkle it in tacos, or create a curry. 3. Can ginger get rid of nausea? Ginger is a tropical plant that's been used in Asian cultures for thousands of years to treat stomach upset, diarrhea, and nausea. In the U.S., it comes in a variety of convenient forms: lollipops, candies, capsules, and teas. You can also purchase the dried powder in the spice aisle of the grocery store, or buy it fresh to make teas or grate into recipes. Research has found that ginger is effective at calming pregnancy-related nausea and reducing tummy upset after surgery. Some studies have also found that ginger cuts the severity of motion sickness or prevents the symptoms altogether. It may even help with chemotherapy-induced nausea and vomiting when taken along with anti-nausea medications. Ask your doctor first before taking ginger while on chemotherapy drugs, as it can have a negative interaction with certain medications. Meal tip: work this zingy spice into your diet by adding it to stir-fry dishes, smoothies, or sipping it in tea. You can also add it to homemade salad dressings and baked goods. 4. Is garlic good for your heart? Most of us are familiar with garlic, the strong-smelling bulb frequently used in cooking. But what you might not know is that eating garlic may protect your heart from changes that lead to heart disease. As you age, some hardening of the arteries is normal. This is called atherosclerosis and occurs as fatty deposits made up of cholesterol and other substances build up on the inside of your artery walls. Factors such as smoking, high blood pressure, and high cholesterol can make it worse. As the buildup increases over time, the arteries narrow. This can make you susceptible to heart attacks and strokes. Researchers have linked garlic intake with keeping blood vessels flexible, especially in women. In addition, studies suggest that eating garlic may reduce cholesterol and triglycerides. Garlic is a key ingredient in the Mediterranean diet, an eating style that heart doctors often recommend. It can be used in any number of savory dishes. Meal tip: pair fresh or powdered garlic with olive oil and pepper to flavor vegetables, or use it with rosemary to make a tasty meat rub. You can sprinkle it in soups and salad dressings too. 5. Can cayenne relieve pain? Cayenne is a type of chili pepper that you'll find in Southwestern American cuisine, as well as Mexican, Creole, and Cajun dishes. Cayenne peppers contain a substance called capsaicin. It's what makes them spicy and also what can provide pain relief. Capsaicin reduces the number of pain signals sent to your brain. The result? You don't register as much discomfort. It works on pain caused by arthritis and diabetes-related nerve damage. You can apply creams with capsaicin directly on joints and muscles. Lab research and studies in animals suggest that eating cayenne pepper can also help with something that causes a lot of internal pain: ulcers. Although people often associate spicy foods with stomach upset, capsaicin aids in helping reduce ulcers by restricting the growth of an ulcer-causing bacteria, Helicobacter pylori, or H. pylori, reducing excess stomach acid and increasing blood flow. Meal tip: use this spice anytime you want to add heat to your food. It's great in chili, soups, stews, and on meat. For a fun twist, add a dash to hot chocolate. Healthiest ways to use spices. Whether you use spices fresh or dried, you'll still get beneficial compounds. Experts point out that frying or grilling can decrease spices' antioxidants, while microwave cooking, simmering, or stewing foods with spices can actually heighten their antioxidant levels. If you're tempted to take supplements to increase your dose of these beneficial compounds, it's important to note that commercial supplements aren't strictly regulated, which means you can't be certain what the pills actually contain. Certain third-party organizations do testing to verify quality and contents of supplements. If you're thinking about taking a supplement, talk to your doctor or dietitian about what form and amount is right for you. Regardless of the other health benefits, spices add flavor to food and can make healthy meals delicious and are a healthy way to get you out of an eating rut. Enjoying your food is key to maintaining healthy habits for the long term. Be sure to talk to your doctor or a dietitian before changing your diet. Try this: stewed chicken. We often associate cinnamon with sweet foods, but it works in savory dishes as well, like this stewed chicken. Try this sweet and savory recipe. Ingredients: 1 tablespoon olive oil, 1 pound chicken breasts, salt, optional, and pepper. 3 cups chopped vegetables of your choice. We like spinach, carrots, and onions. Fresh or frozen will work. Frozen are often cleaned and cut for you, which can save time. 1 14.5-ounce can or box diced tomatoes. half teaspoon cinnamon, half teaspoon cayenne, half teaspoon turmeric, 1 teaspoon cumin, fresh or dried parsley for garnish. Optional. Rice or couscous for serving. Cooking times vary, so make sure you plan accordingly so it is ready when the chicken is done. Directions. Heat the olive oil in a large sauté pan. Sprinkle the chicken with salt, if desired, and pepper, and add to the pan. Brown each side of the chicken. Add the vegetables to the pan and sauté until soft, 5 to 10 minutes. Add the tomatoes, cinnamon, cayenne, turmeric, and cumin. Simmer until chicken is cooked through, to 165 degrees Fahrenheit, and vegetables are soft, about 20 minutes. Top with parsley, if desired, and serve with rice or couscous. Most of people watching this channel have not yet subscribed. I ask that you please click the subscribe button below, share, like, and follow for more nurse tips. Health is wealth,